Daily Health, we wanted to take a closer look at a degenerative brain disease making headlines this week over its possible link to the tragic shooting Monday in Midtown Manhattan.
CTE is a brain condition caused by repeated injuries to the head. It can be linked to contact sports, according to the National Institutes of Health. The gunman on Monday was a former football player who authorities believe may have been targeting the NFL's headquarters.
A note found in his wallet and reviewed by NBC News mentions CTE several times. It's unclear now whether the gunman had CTE, but the medical examiner said his brain will be examined as part of the autopsy. Joining us now is neurologist Dr. Leah Kroll. Dr. Kroll, thank you for being with us. First, can you just start by explaining what CTE is and what exactly causes it?
So CTE stands for chronic traumatic encephalopathy. And as you mentioned, it's a progressive neurodegenerative condition that happens as a result of repeated blows to the head. What's happening is those blows cause an accumulation of a bad protein called tau in the brain, and that causes permanent neuronal cell damage and dysfunction, leading to cognitive and behavioral dysfunction in patients. And one thing to add here is that unfortunately we cannot diagnose this in living patients. We need an autopsy to definitively make that diagnosis.
Yeah, and that said, Dr. Kroll, are there signs or symptoms that someone might have CTE?
Absolutely. So there's generally three categories of symptoms here. The first is cognitive. It can look a bit like dementia, so memory problems, difficulties with organization, planning, executive function. Then you have some mood and behavior symptoms like mood swings, depression, suicidality, impulsive behavior, aggressive behavior, even violent behavior. And then finally, there can be some movement symptoms, difficulties walking, talking, issues with coordination.
So, doctor, talk more about what can put a person more at risk for CTE, and are there ways to protect yourself?
This is really a hot button issue. Of course, classically, when we hear CTE, we think NFL and contact sports, football, hockey, wrestling. But it goes far beyond that. Certainly people who have a history of military service are at risk for this. Any sport that may involve a little bit of contact with the head, so soccer, headbutting, can do this as well. And you don't even need full out concussions to get CTE. Subconcussive hits can count too. So in general, you want to minimize the number of hits your head takes. If you're a parent that's watching, you want to talk to the coach, the gym teacher about what protocols are in place to protect the kids. And of course, always use a helmet.
Yeah, and doctor, you mentioned that CTE cannot be technically diagnosed in living patients, only by autopsy. So what are ways to manage it if someone thinks that they may have it?
The trick, of course, is that since we don't have that way to diagnose in living patients, it makes it very difficult to research treatment options for patients with CTE. So we don't have a treatment that's specifically designed to target the disease, but we do have our treatments that are meant to help manage the symptoms. These are things like cognitive behavioral therapy, speech therapy, physical therapy, occupational therapy. Some patients may benefit from certain medications, but really important to get checked out because you don't have to suffer with these symptoms alone. People can help you deal with them. And of course, CTE overlaps with a lot of other neurologic and psychiatric diseases. Yeah. So always getting checked out.
Yeah, you don't have to suffer alone. Also, prevention is key, as you're saying. When should someone, though, see a healthcare provider if they do think they may have it?
Yeah, so one thing that makes CTE different than other neurodegenerative diseases is that it doesn't necessarily impact older people. People in their teens, 20s, 30s can be impacted as well. So if you're anyone who has a history of repeated head traumas, whether you're an athlete or somebody who served in the military, and you start developing cognitive or behavioral symptoms, that's reason enough to go get checked out.
Dr. Leah Kroll, really important information. Thank you so much.